21. The second priority needs according to the MAUAR method of priority setting include which of the following? Assessment, movement, understanding level, risks. Answer, D. One of the second priority needs according to the MAUAR method of priority setting is risks. The ABC/MAUAR method of priority setting places the ABCs, again, as the highest and greatest priorities, which are then followed with the second and third priority level needs of the MAUAR method of priority setting. The second priority needs according to the MAUAR method of priority setting after the ABCs include MAUAR, which stands for mental status changes and alterations, acute pain, acute urinary elimination concerns, unaddressed and untreated problems that require immediate priority attention, abnormal laboratory and other diagnostic data that are outside of normal limits, and risks including those relating to a healthcare problem like safety, skin breakdown, infection and other medical conditions. 22. Which of these skills is most closely related to successfully meeting the established priority needs of a group of clients? Time management skills, communication skills, collaboration skills, supervision skills. Answer, A. Time management skills are most closely related to successfully meeting the established priority needs of a group of clients. In addition to prioritizing and reprioritizing, the nurse should also have a plan of action to effectively manage their time. They should avoid unnecessary interruptions, time wasters, and helping others when this helping others could potentially jeopardize their own priorities of care. Although good communication skills, collaboration skills and supervision are necessary for the delivery of nursing care, it is time management skills that are most closely related to successfully meeting the established priority needs of a group of clients. 23. Which is most closely aligned with ethics? Morals, laws, statutes, client rights. Answer, A. Morals are most closely aligned with ethics. Ethics is a set of beliefs and principles that guide us in terms of the right and wrong thing to do, which is the most similar to ethics. Laws and statutes define what things are legal and what things are illegal. Client rights can serve as a factor to consider when ethical decisions are made, but they are not most closely aligned with ethics. 24. Select the ethical term that is accurately paired with its brief description. Deontology, the school of ethical of thought that requires that only the means to the goal must be ethical. Utilitarianism, the school of ethical of thought that requires that only the end goal must be ethical. Deontology, the school of ethical of thought that requires that only the end goal must be ethical. Utilitarianism, the school of ethical of thought that requires that only the means to the goal must be ethical. Answer, B. The two major classifications of ethical principles and ethical thought are utilitarianism and deontology. Deontology is the ethical school of thought that requires that both the means and the end goal must be moral and ethical, and the utilitarian school of ethical thought states that the end goal justifies the means even when the means are not moral. 25. What ethical principle below is accurately paired with a way that ethical principle is applied into nursing practice? Justice, equally dividing time and other resources among a group of clients. Beneficence, doing no harm during the course of nursing care. Veracity, fully answering the client's questions without any withholding of information. Fidelity, upholding the American Nurses Association's Code of Ethics. Answer, C. Fully answering the client's questions without any withholding of information is an example of the application of veracity into nursing practice. Veracity is being completely truthful with patients. Nurses must not withhold the whole truth from clients even when it may lead to patient distress. Justice is fairness. Nurses must be fair when they distribute care and resources equitably, which is not always equally among a group of patients. Beneficence is doing good and the right thing for the patient. It is nonmalficence that is doing no harm. 26. One of the roles of the registered nurse in terms of informed consent is to Serve as the witness to the client's signature on an informed consent. Get and witness the client's signature on an informed consent. Get and witness the durable power of attorney for healthcare decisions signature on an informed consent. None of the above. Answer A. One of the roles of the registered nurse in terms of informed consent is to serve as the witness to the client's signature on an informed consent. Other roles and responsibilities of the registered nurse in terms of informed consent include identifying the appropriate person to provide informed consent for client, such as the client, parent, or legal guardian, to provide written materials in client's spoken language, when possible, to know and apply the components of informed consent, and to also verify that the client comprehends and consents to care and procedures. The registered nurse does not get the client's or durable power of attorney for healthcare decisions signature on an informed consent. This is the role and responsibility of the physician or another licensed independent practitioner. 27. Which of the following is most closely aligned with the principles and concepts of informed consent? Justice, fidelity, self-determination, nonmalficence. Answer C. Self-determination is most closely aligned with the principles and concepts of informed consent. Self-determination supports the client's right to choose and reject treatments and procedures after they have been informed and fully knowledgeable about the treatment or procedure. 40. Which of the following is not an essential minimal component of the teaching that occurs prior to getting an informed consent? The purpose of the proposed treatment or procedure. The expected outcomes of the proposed treatment or procedure. Who will perform the treatment or procedure? When the procedure or treatment will be done. Answer D. The minimal essential components of the education that occurs prior to getting an informed consent include the purpose of the proposed treatment or procedure, the expected outcomes of the proposed treatment or procedure, and who will perform the treatment or procedure. It is not necessary to include when the treatment or procedure will be done at this time.